So sometimes when they leave the hospital, they have no clue in the world of what they did in the hospital in terms of procedure or what they were being admitted for. Oh my word, it starts raining here. And you know, when it comes on to rain in Texas, everybody tend to not be excited, because when you look the amount of accidents you see on the road, you have to wonder how much rain was falling. So yeah, sometimes it's just a little drizzle. The rain just comes down for 2 seconds, and then you realize there are about 10 different accidents on the highway before you can even get off. So yeah, I wish I could turn the camera so you could actually see, but I don't know how to do this as yet. Remember, I'm new to this vlogging thing. I'm new to YouTube, so I'm getting a hang of it as we speak. All right. I saw another patient as well. It was 2 patients. I went to a group home to see. I drove down there. It was probably like a 1 hour 20 minutes drive, and before I confirmed with the group home owner, and I also called the patients to find out if they were okay with me coming in, because I know sometimes, you know, the group home owners, they don't ask the patient because it's a part of their requirement. So one thing I love about some of the group homes that I've worked with is that even though you have some patients that are being taken into those homes, they're not just there lying down, eating, sleeping, and watching TV, smoking. No. If, so for example, those patients are taken from the streets and being housed there, those patients, some of the group homes, they will have the patients go under some evaluation. So for example, you have a patient that is diabetic, and you have a patient that is has some psych problems. Then they will definitely have a medical evaluations done on all the patients. They will definitely have a medical evaluation done on all the patients, just to make sure their health is in good condition, get their medications back on track. And so for example, their psych, you know, they have a psychiatry team that they work with come in and see the patients. And those group homes, I really appreciate them. I really love working with them, because they're not only housing patients, they're actually taking care and making sure that the patient is well, because they advocate and bring in, you know, persons, medical specialists, to come in and see the patients. Can you imagine you wake up one day and just see your group home damaged? You would be upset. Any person would be upset. And even though you're getting paid by whoever, it can be government, it can be, you know, the patients themselves who are doing self-pay, you are disturbed about the fact that they're ruining your thing. So you don't want it to be a case where they come in one day to see that there's a big punch in the wall. No, who wants that? You're providing a service, and you want whatever you're providing to be good. So you look after whoever you're putting in by providing medical professionals to come in and see them and treat them, because that's the only way for you to protect the other persons who you are caring for or you're housing, and that's the only way for you to protect yourself and your staff and the patient themselves. So I really appreciate working with those group homes, because they go above and beyond. Some group homes, when you go there, you can see why you can see why the situation is like that, because nobody is looking after the patient. You know, they're just taking the patient's money, they're just feeding the patient whenever, and the patients just do whatever they feel like. And so when you go there, the house is in shambles, the group home is in shambles. So I really appreciate, you know, working with them. Not all the group homes do that, but majority of them that I've worked with, they do have their patients see them. If it's a case where they're constantly refusing to be seen, then they sometimes can go ahead and dismiss them from the group home, and then you'll realize that the patients change their mind about the refusal. So it's always a big laugh though sometimes, because some of these patients, I'm like, you're behaving like this when you already know your agreement with your group home owner. You already know the agreement with your group home owner, you know. So don't let it be a case where, you know, what you're supposed to be doing something and you're not following through on it, because then eventually you're going to go back on the street. So that's just it. So I went in to see those 2 patients at that group home, and as I say, I drove 1 hour 20 minutes down there to see them, and they were literally not coming out of their rooms for the last 30 minutes. So I was there and I'm like, this doesn't make any sense. And the only reason I spent 30 minutes there is because for each patient I have, let's say, about 30 minutes with them. That's the time I'm gonna give them. I don't need 30 minutes with them, but I kind of try to do 15 to 30 minutes. But most of the time I don't do that. I drove 1 hour 30 minutes to come down here. The least I can do is do the evaluation. So I was there, and none of them wanted to come out because they were sending somebody to tell me that, oh, the only person they're going to be seeing is a psych provider. The only person they're going to do is this. The only thing they're going to do is that. So I'm like, okay, then, you know what? I'm going to go my things up and, you know, head out. And when I was at the car, it was at that time they're going to be coming to tell me that, oh, this one says she will be seen, but she's going to have a bath. I say, yeah, she can have a bath, but at the end of the day, I'm not going to be waiting any longer. I'm going to be going. We will have somebody else arrange to come in and see you guys if it is a case that you're ready and willing to be seen. Because it doesn't make any sense you agree to something, and then when it is time for the evaluation, you're pretending as if you don't know what the expectation is, and you don't know that you had an appointment for the evaluation. That doesn't make any sense. So that's just sometimes what happens. You have patients who are indecisive even when they already confirm with you. But what can you do more than, you know, continue seeing your other patients? Just try not to miss your appointments with your other patients. So even though you might have had a cancellation with another patient, and you know, you spend some time there, do not waste your time trying to figure out and trying to get that one visit going. If they said they don't want to be visited or they don't want the evaluation, just let it be and just continue seeing your other patients so you can keep that momentum going, and try not to miss or be late for your other appointments that you have scheduled. That's the only thing I can say, because if you follow some of these patients, you will be late for all of your appointments. You will be late for all of your appointments because they have so many things to talk about, and the only time they get a chance to see a provider and talk about it is when you show up. So just be mindful of that. Not all the time it's gonna be good. Alright. Oh, this is where this hospital was. Okay, interesting. Alright, so I don't want to stay that long down here, because as I say, it's gonna be raining, and I don't know if you're able to see the sky, but it's overcast. Alright. And the rain is still drizzling, so I promised the gentleman an appointment for 11. I think I'm gonna be there for 11:15. This is saying, yeah. But they know me already, so if I tell them that I'm gonna be there for 11 o'clock, and sometimes, you know, if they don't see me exactly at 11, I'll be there for 11:15. So, and that is an established relationship or communication that we did. So the patients already know that that's just my standard. If I'm running late, if it's over the time, then there's a 15 minutes chance of me showing up. If it is, and you don't get a call from me, that is. But if it is longer than that, I'll definitely call and say, hey, this is the situation. So it's either, if you want to wait for a little bit longer, that's fine. If you want to cancel, that's okay. But that's the time I'll be there. Because as I say, sometimes the appointments, they go for a little bit longer than you already established. And if you know, when you go to a doctor, sometimes you go there for an appointment visit, and then it's that time you remember all of the different ailments that you have, you know, all the different complaints that you have, and you feel as though it is at that time you want to just spill the bean and just go through everything. And it's the same thing with these patients. They are seen once a month, and sometimes they have so many things going on, especially if they've been to the hospital where they've been admitted and discharged with a numerous amount of medications. Then sometimes they just have so many things to discuss. And not only that, Sometimes when they leave the hospital, it's like they're clueless. So sometimes when they leave the hospital, they have no clue in the world of what they did in the hospital in terms of procedure or what they were being admitted for. I know probably, you know, they probably weren't actively listening, and so it sounds as though nobody explained to them. But a majority of the time, the patients are saying they don't know why they were in the hospital. So, you know, you have to go through everything now with them as best as you possibly can, so that way they can feel comfortable. Because sometimes they already know that they're diabetic, you know. They already know that they're diabetic, or they already hear at one point that something is going on with their glucose level. You understand? But the patients don't understand that if somebody said that your glucose is high, you're probably diabetic. So when you go down and you say, okay, then I'm going to check your glucose every 3 months because I want to make sure your diabetes is doing well. They're like, but I don't have diabetes. And you're like, oh my word, there we go again. And you have to still explain. You have to go through the labs and be like, this is the situation with your A1C, this is what your levels have been showing, and this is why we're treating you, for them to actually understand. So sometimes your visit tend to be a little bit longer than, you know, the usual. But what I tend to do as a practice is, for every time I meet a patient for the first time, I try to go through their medical diagnosis and their medications thoroughly. So your first visit with your patient is usually a little bit longer. At least that's it for me. It's a little bit longer because I try to make sure I explain to the patient what the expectation is going forward. If you're diabetic, I'll be doing your A1Cs every 3 months. If you have hyperlipidemia, or if you have high cholesterol, I'll be checking your levels every so often, you know, just to make sure that the medications we put you on are working. If this is going on, this is what we'll be doing. So the expectation is already set and they know what will be happening. So that's the thing. So when I go and see them, I don't have that much, you know, questioning regarding, oh, I never know that I have diabetes. Oh, I never know that I have hypertension. Oh, I never know that my kidneys were malfunctioning, you know. So they have the understanding, and so it's easier for me when I go back to see them for their follow-up visits, because they would have already been informed what their labs are looking like, what their, you know, their diagnoses are and all. So I tend to have a good relationship with my patients regarding, you know, just communicating with them about their conditions and what to expect during the visits each month. So it's fine. It's just that when you're meeting them for the first time, then you realize that your visits are a little bit longer. And if it's already long, just spend the time and explain to them what exactly is going on with them so they can have that understanding. So when you get there, it's less confusion for you, less questions for you, on questions that you know they should have been aware of from long time. Because diabetes, some of them have diabetes for the last 30 years, 40 years. It's not the day when you show up they were diagnosed with it. So some of them have diabetes for the longest time, but they weren't explained, you know, or probably they don't remember having a conversation in detail regarding it until when you bring it up again to say, well, your diabetes is not looking good, so we need to see an endocrinologist, and they're asking you, what do you mean by my diabetes, you know? So there are different time periods that you will spend with your patients, but as you go along, you know, based on you would realize that based on the education of the patient, that contributes to how long you'll be staying with them. Because the patient has a good knowledge of how to use the internet and they have access to their portal, their health portal, then they will be able to do research, and then they will just ask you specific questions whenever the time arises. So it depends on the educational, you know, background of the patient that contributes as well to the length of your visits. But overall, your visits will be fine. As I say, depending on how you work, how you balance your time, manage your time, it will work out well for you. Oh my word, it is so rainy now. Okay, but then the sun is still peeping out, so not bad, not bad. I have 7 minutes to go. And then so this patient that I see every month, that I'm going to see now, he is a veteran, so he also gets followed up with the VA clinic, and he also gets followed up with us. So you know, with the VA clinic, there are certain things that they offer. Some of the patients, you know, they have bad things to say about the VA. I don't know if it's because of the amount of patients that they see. I don't know what the problem is, but a lot of times I hear people talking about the VA the service that they get from the VA, and they might not like it, so they sort other providers to assist with their management, but they still do get certain testing through the VA clinic. So what we do is when they go and see their specialists or their doctors through the VA, I always encourage them to go ahead and collect those results, so that way we don't have to be doing the test over and over. So if you know you were at the VA clinic and you had testing done, I encourage them get the results, and then I will just use it as a part of, you know, the management in our practice. And it's the same thing if they go to the cardiologist. I say go and get the results, so that way, you know, we can always be on par with what's going on. And I still use the results from those tests that they did to help with. So if you're a diabetic and you went over to see your cardiologist or your endocrinologist 2 months ago, and they do your A1C, then I don't go ahead and order A1C on you, because you're already being managed for that. You already had a test done 2 months ago. So if your endocrinologist don't do the A1C at the next visit, which is a 3 months visit, then I will go ahead and do it. So that way we don't miss that time period for your quarterly checks. And so that's the way I look at it. It's saving the patient. It's more economical for the patient, rather than doing, you know, everybody doing A1C tests on the patient. So you have patients getting A1 tests done through, you know, their primary care provider. They're getting it through endocrinology. They go to cardiology, they're getting the same test done. That doesn't make any sense for the patient. It's just costing the patient too much money. And so we already know that money is short. It is scarce. So if you can minimize, you know, the amount of tests that your patients get, and it's plus for each of those tests, the patient is going to get a poke, you know, the patient is going to get a blood draw. For each of those tests, the patient is going to get a blood draw. Nobody wants that. Nobody wants that. You don't even want a mosquito to bite you. Much as to have somebody sitting down or trying to get blood from your arm, you know, to get testing done every time you go and visit them. And that is one of the things I think probably contributes to why patients are, you know, not so consistent with following up with the providers, because of the frequency of certain testing. You know, you can imagine every month you go to your doctor and they want to do blood. They want to go do blood. That doesn't make any sense. Like, that is going to contribute to why some patients are non-compliant with certain things. So just make sure you know your patients, know what specialists they're seeing, and if you can get test results from those specialists to add to your system to help with the management, because remember, it's a collaborative management you're doing. You're collaborating with other providers. So if they do their testing and they're doing whatever, just go ahead and use the same results for your practice when you're able to do so. You know, so that's it. So I'm gonna see him today. As I say, he follows up with the VA, so he gets his blood test done. Already had a cardiologist through the VA clinic. But you know, some of these patients, they have their insurance with the VA, and they also have a private insurance. And so he wants to have one, because I think with the VA, they don't really have that much accessibility when it comes on to certain things. So some patients, they like to take things in their own hand in terms of their health and get certain things done. And so he wants to see the cardiologist whenever he feels like, privately sometimes. And so he asks for that. So I'm going to see him today. I'm not going to order any medications because he gets all of those through his VA clinic. So we're just checking in with him to see how he's doing and all. I know the last time he has been treated for Parkinson's disease, and he was seen by his neurologist, and he was complaining that the tremors are still there, but he was just like started on the medication. So I said, give it some time, you know, but I would recommend him just follow up with his neurologist regarding that. But he had already done that. So some of these patients, they think they're smart, you know. They think they're smart. They already see the specialist who manages their Parkinson's, their diabetes, you know, their heart problem. And then if their specialist says something to them, oh, we're not going to change the medication, or we're not going to adjust the medications until, you know, 3 months time. Let's see how you're doing on the medication before we adjust it. Some of the patients will come and be like, well, I want this medication to be changed. And I'm like, well, unfortunately, I'm not going to change it until you go and follow up with your cardiologist. Seeing that your cardiologist is the one that manages, let him have the go-ahead with making the changes on the medication. And they're like, oh yeah, I already spoke with him and he says in 3 months he'll change it. And I'm like, oh my word, these patients sometimes, you know, these patients sometimes. So they already spoke with the cardiologist. They already spoke with they already spoke with the cardiologist, neurologist, and all the different specialists who they're seeing, and they're telling them, no, we're not going to change it. But then, just like this gentleman, he wants his medication for his Parkinson's to be adjusted. He wants me to go ahead and increase the dose. And I'm like, you just started on it. I'm going to have you follow up with your cardiologist, your neurologist rather. And he was like, yeah, I already spoke with him and he says the same thing. So I'm like, oh. So I just explained to him that, you know, whenever you are seen by a specialist, I personally prefer for them to go ahead and just continue managing you unless they say otherwise. You know, that's their area of specialty. And if they already have an agreement with you, let them just go ahead and run the show. All right, so I'm gonna go in and see him, and then once I'm finished, I'm gonna see another lady, and then that's it. All right, until then, thank you so much for tuning in. I'll see you. Bye.